everyone. Welcome to researchmd.com. We got another great presentation today, and we're going to look at today the association. Is there a link or is there an association between fatty liver disease and the cirrhosis of the liver? Okay. So again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency program, transitional residency program. I'm a physician by profession, and I have a master's in clinical research. I also hold assistant professorship at Hackensack School of Medicine. So my goal is today is to let's talk about like what is the relationship with the non-alcoholic fatty liver disease and the liver cirrhosis. So most of the times, or when you go to a doctor's office, a regular checkup, and they have did some kind of imaging like a CT scan or like an ultrasound of the abdomen, and the doctor tell you, hey, we got some fat on the liver. So why should we be worried when you have somebody tell you that? Okay, that's the whole purpose of the scientific analysis of the scientific paper. So for this study, there's a great article published in the BMC journal. So you kind of looked at the association between cirrhosis and the fatty liver disease, and we're going to briefly talk about that paper today. So what is non-alcoholic fatty liver disease? To give you an update, so it is deposition of fat on the liver cells. Okay, there's two terms you have to be familiar with. One is NAFLD. This is called a non-alcoholic fatty liver disease, and the other one is NASH, NASH. This is the non-alcoholic steatohepatitis. Okay, the difference is like the initial stages, what you see is the non-alcoholic fatty liver disease, just the fat kind of sitting there. What happens when the fat sit on something else? It's just going to attack the cells. There's inflammation, tissue damage, and all that. So that can lead to NASH, which is non-alcoholic steatohepatitis. Okay. So when you look at it, the objective of the study was to look at the association between the non-alcoholic fatty liver disease and the liver cirrhosis. Okay. So methods they used, they got this huge database. In these European countries, they use socialized medicine. So the database is like very, very strong. Anytime you see a study come out of that, take it very seriously. They do a very good job compared to the American counterparts, I think. They have the network like HSD, Health Service Data, IPCI, Integrated Primary Care Information, SIDIAP, Information System for the Development of Research and Primary Care Data, and the THIN, the Health Information Network. And they combined all this, and how many people they have? 18 million people in this study, okay? So they put this 18 million people, and then they used a diagnostic code to pull out all the people with non-alcoholic fatty liver disease and with a diagnosis for non-alcoholic steatotic hepatitis. Okay, so we got 136,703 people in our study with that diagnosis. Follow-up period, average follow-up period for the study was 5.4 years. And then this is our main picture of the data. If you look at the diamond, it's kind of tell you all the pooled data and see like the information. So look at the bottom with the combined, with NAFLD, and there is a hazard ratio, we can say, is expressed as 22.67. Okay, that means you have, almost like 2,100% more likely to have liver cirrhosis when you have fatty liver disease. Okay, so next thing is they also look at the other factors associated with developing liver cirrhosis. The first one is association age. We know like the older we get, more diseases we get more likely, right? So age is associated with it. History of diabetes, so they have diabetes. So if you have fatty liver disease and you have history of older age, and if you have history of diabetes, your risk of having liver cirrhosis like extremely high. Okay, just remember that. So what are the strength of the study? Strength of the study, the large number of participants, no pharmaceutical funding, match case and control. So we did well study with the available data. So again, the huge number of patients kind of make us like a lot of information. So in conclusion, this study clearly indicates that fatty liver disease is associated with a very high risk of developing liver cirrhosis, and we have to take it very seriously. Somebody said, I have a fatty liver disease. There are a lot of measures you can to decrease the incidence of having, complications. Okay. Again, thank you so much for joining us today. Please subscribe to our channel we'll be back with another presentation. Thank you again.